Good afternoon, everybody. Today is August 26th, 2022. This is our every other week COVID-19 update. My name is Scott McGann with the Falmouth Health Department. Our phone number is 508-495-7485. Our email is health@falmouthma.gov, and our website is falmouthma.gov. So we're at 5,312 PCR confirmed positive tests for COVID. That's 34 confirmed PCR over period ending. Actually, I should have fixed that. That's this past week. I'm sorry, I didn't mean to fix that slide, but that is as of yesterday. And the previous week saw 43. So 34 this week, 43 last week. Sorry about that. I didn't change the August 11th on there. But 34 this week, 43 last week, which is pretty similar pattern that we are. Again, these are confirmed PCR. These are not home kits or any other type of test. So it's been pretty stable, maybe a little bit lower. We're probably around 45 to 55. Now we're 35 to 45. So over the last couple of weeks, a little bit down, but not much. It's kind of been the similar pattern we've had all summer. I don't know what the multiplier is for home kits versus PCR. There's some factor higher because we're not counting home tests. They don't get counted into the system. So if there's been for example, let's say 150 earlier in the summer, we might be down to 120 or something of that nature. But just take these numbers with a grain of salt. That there's a fair amount of COVID out there. There's been a fair amount of COVID out there all summer. Maybe a little bit less later in the summer than it has been early in the summer. But still, there's quite a bit of COVID. And I'm sure you know that by friends, family, yourselves or not, coming down with COVID over this past summer. 5 probable cases in those 2 weeks. That's not home test. That's going to a place like Convenient MD or CVS and getting a rapid getting a rapid antigen. Positivity is a little bit higher for the 2 weeks. It's 16.7, previously 15.6. Again, it's got a lot to do with not a lot of PCR testing as well, but the percentages are, the incidence, because this incidence rate's based on percent positivity matters on how many tests are actually done. And that's been pretty, 7.28. I think we're, actually I meant to change that slide as well. Sorry about that. So if you go down to, let's go right up to here. We were at 7.45. And that previous week was 7.28. So pretty similar, 7.5 to 7.28 and 16 to 7. So it's pretty similar week to week. So our incidence rate is how many positive PCR tests, adjusting our population to 100,000, how many daily cases we would have. So that's somewhere around 5 or so, 5 to 6 cases per day of PCR. And so that's pretty stable. That's really stable. Looking at the county, we went to green, which reason we were at, the last time I did the presentation at medium was the new COVID admissions per 100,000 population. That number was 10.2-ish. We're at 8.3. That brought us into low. Our case rate in the county, this is county numbers, not Falmouth. Our case rate is per 100,000 is 105 cases per 100,000 with the hospitalizations of under 10 for new COVID admissions per 100,000, and the percentage of inpatient beds being used with confirmed COVID is 3.1. That's far less than 10, which puts us in the low, which is good. You look at, this is the same thing from the CDC. This is all the hospitalization trends. You can see we're pretty flat. We've been pretty flat, a little bit of a blip here and there, but relatively flat. You see a little bit of a drop at the end here for the daily percent beds used, but fairly stable summer. I guess I'd sum it up best is there's a fair amount of COVID out there. Most people are doing fine, and the hospitalizations in the hospitals are not being sort of blown away by the number of cases. Of course, primarily because we're heavily vaccinated. If you look at the entire country, there's a drop of 4.33% out of the high, and the gains were in the medium and low. So there's been a net sort of decrease in the metrics. So it's a little bit more green, a little bit more yellow, a little less orange. And so that's where we are with that. Last time I did the chart, it was 8,900 for confirmed cases. They're only doing this on a weekly basis. It's 79. Again, we're seeing it less, but still at a fair amount. So 79 from 89 And we're similar to positivity to where you're finding it throughout the state, 7.8. We're in the 7.5, 7.3-ish range. So again, state trends, similar trends to what we're seeing, flattened, sort of a little bit on the downward sort of slope a little bit with cases, very flat with deaths. Deaths, this again, vaccines had a lot to do with this, and Omicron not necessarily being causing the sort of that severity. Not that that can't happen. Positivity's really been flat. Hospitalizations are relatively flat, slightly up, but I think that's pretty flat. Looking at MWRA, that's the sewer system for Metro Boston area. They're measuring signal, the RNA signal from COVID. You can see this in sort of you see a sort of a similar pattern where it's kind of stable with a slight dip towards the end, and that's what we're seeing with the MWRA numbers, case numbers. Even Falmouth numbers are all sort of in a slight decline, but still, a fair amount of it out there. Again, our incidence, this is our incidence rate. This is how many daily cases we would have if we had 100,000 population, which is 16.7, which is a slightly middle to high end for the rest of the county for that particular time frame. And our positivity is sort of mid-range, right in that 7.45, with some towns being as high as 10 to 13, 11, some lower around 6, a couple of ones and zeros. And so that's pretty similar pattern, again, as we've been seeing all summer. Vaccines. So vaccines are readily available. We go on every week, and we see that there's plenty of open slots for adults over 3, 5, depending on the place, will be age 3 and over, or 5 or over. You can get them at the pharmacies, convenient MD, community health centers, things of that nature. Homebound, you can always call the health department. If you know someone who's homebound, we'll send somebody out from the VNA to do it at their home. Again, plenty of open slots. The difficulty, and I've had about a half dozen calls this week, are children, under 3. It might be difficult to do that outside your pediatrician's office. The world of vaccines for children has generally always been done out of the pediatrician's office, but with people here at their summer homes and nowhere near their pediatricians, so we've had some calls. I went on VaxFinder. I see that Convenient MD can do them for 6 months and older, and then the state-run 4Cs does that as well. So on VaxFinder, you could sign up that way. But primarily, the reason being is it's liability and so forth. The CVSs and so forth aren't interested in doing the real young ones, and that's, the system has been the pediatrician's office. So if this might take care of itself for the most part as people go back home, but people that don't have pediatricians, again, try Convenient MD. Try the 4Cs. There's nothing from the community health centers, like that could be a possibility. I don't see them on VaxFinder, so you might want to call them directly. So that's, you can call the health department too. If we find anything new, then we'll definitely relay that to anybody. So, but as anybody who's over that age, anybody's 5 and over, it's real easy. There's some booster talk. They're going to incorporate Omicron in the next month or two, and then of course we'll give that information as it comes. There's no third booster dose info that I had as of the other day when I looked, but that'll change. I'll put a new slide as I see things for the next time that we do this. Testing hasn't changed. Most people are doing the home kits. Again, Falmouth Hospital is still open. The Convenient MD and the pharmacies are still doing them. So testing is still, home kits is where most people are. That's why there's a multiplier beyond what we're seeing for PCR positives. And it could be 5, it could be 7, it could be 3 times, I'm not sure. Guidance had changed a couple weeks back. You do not need to quarantine if you're exposed, just wear a mask for 10 days. Good to get tested, right around day 5 after your exposure. Give you a good sense of whether you got it or not. If you have no symptoms, still get that test. The home tests are pretty easy to get. High quality mask, and work on your social distancing and so forth, especially if you're in contact with somebody who might be high risk, immune compromised, elderly, so forth. Positive is not changed again. It's 5 days minimum. Wear a mask through day 10, but that 5 days means you still shouldn't be sick. You still might have a lingering cough or something of that nature, but your symptoms, especially your fever, should be resolved. That hasn't changed. So we used to quarantine based on your vaccination status. So you'd have to quarantine if you were not completely vaccinated and boosted, and that's been taken out. Vaccination rates, slight bump on vaccination rates, 111 through the 2 week of the 8th through the 22nd, 46 boosters, 22 second doses, 43 new doses, most of them being up in the younger age, because you've had plenty of opportunity to get vaccinated. And occasionally people will change their minds and be vaccinated for the first time. What is out there? Well, the BA.5 is that sort of darker green. That has been the predominant one, although it's been flatlined, so to speak, over the last few weeks since the end of July. There's been a creeping in of the 4.6, but it's not taking over, it looks like, as quite rapidly as you see, let's say, the dark green taking over the BA.2, so the BA.5 taking over the BA.2.12 relatively quickly, each week. You're seeing still the predominant one being BA.5 without you don't see that quite. The trend is a little bit more of the 4.6, but it doesn't seem like it's just quite taken over the BA.5 as that. But they're also that similar Omicron, and then the hope is the next booster will have some Omicron in it. So as a recap, our counts are stable. Everything's sort of slightly down. There's going to be an ebb and flow to this. I'm sure once we get into the holiday season, it'll be up. Whatever Omicron, whatever variants around that point. But, we'll have to just sort of go with the flow, and if things need to change, they need to change. But that's, they're pretty stable for the summer, no doubt about it. So the county CDC is green, which is like low, based on the burden of the disease, the hospitalizations, and so forth. There's plenty of vaccine and testing capability. Again, it might be a little bit more difficult if you've got an infant. Boosters, again, relatively available. BA.5 is the dominant strain with a little bit of 4.6 gaining traction. There are no mandates or advisories other than the select board has kept the advisory for town-owned properties to wear masks. But it's all based on your individual circumstances at this point in time. I see nothing changing on that anytime soon. And then you don't need to quarantine based on your vaccination status of your close contact. So that guidance is also at mass.gov. So that's what I have for this week. It's very similar than I've said the last couple of presentations that I've done, updates. So that's what I have for this particular week, and we'll see everybody in a couple weeks.